Well, so somebody who has these not normal but common issues.
Yeah.
And they're like, well, how the hell is somebody going to help me? What does an appointment with you look like? Because I mean, I honestly, like before I knew about anything about pelvic floor health, I couldn't have imagined like, so great. So what am I going to do? Stand in front of someone and do Kegels? Like,
right.
No, you're actually like going in there.
Going it.
I just did this. I did a 2 finger.
You did too. That's good. That's. I wait for like the third appointment for that one.
You do.
I get to know you a little bit more.
So you just go. You go.
I
in
just
there.
go in. Yeah, I just go.
No, okay.
It's very not scary at all.
Because that sounds very scary. So explain to us.
Okay, can I say something really quick though?
Yes.
Why does that sound scary given the fact that we went through childbirth and there was a myriad of humans like diving into us, tying us up? No, I don't think it's like even that mindset as women, we're like, I can go have some creepy doctor with a metal tool burrowing in there with scissors and scalps and knives and stitches and all of that's fine, but I'm not going to see this lovely woman who's so kind and like wants to help, but like
and I have 2 finger.
Right, and I have a small finger. I always say that. I'm like, I have really small fingers. So like,
I hope that's like the first sentence on your website.
Yeah, I'm like, don't worry. I have, especially people that have like tailbone pain and I have to like go in their booty. I'm like, don't worry. I have really small fingers and I use a lot of lube. You won't even feel me. And they're
oh
like,
my gosh.
Oh my gosh.
Okay, you just blew my mind by what you just said. We'll go back there.
We'll go back. Just file it.
So tell us what is a typical first appointment look like?
Yeah. So every clinic is a little bit different, of course. But for me, when I owned my clinic in Los Angeles, I was one-on-one. So you only saw me. There weren't like aides or other like, you don't like, you're not in a gym, like a typical physical therapy gym where like some dude's sweating on you when you're trying to breastfeed. It's like, what?
It's in the middle of a room, like on a table.
Yeah. I'm like, let's get you a gym. Yeah, it's like it was like a boutique-y practice. Yeah. It's like very serene. I have, a closed room.
Do you get her drunk first?
I have Starbucks. I am, I'm like, I would just like funneling gas and that would be amazing. So it's just a room with me and a treatment table. And then we have a conversation, figure out like what we're doing, what our goals are, kind of what the experience is like and what they want to get out of therapy. Why are you seeing me? Are you leaking urine? Are you having pain? Like, tell me about your birth, all that stuff. And then I leave the room. They get undressed from the waist down. And then I have like comfy sheets, no like paper gowns or any of that shenanigans. And they just
any
cover
of that stuff that's invented by a man.
Correct. No stirrups. No stirrups, no like flashlight, nothing like that. It's like very comfortable. They're in like nice sheets. And then I do like a full exam. I check belly strength. I check scar mobility. I do all external first. I'm checking muscle strength. I'm seeing how tissue is moving. I'm having them breathe, do contractions of your abdominals on the table. Like I'm just looking at basically the entire system. Okay. And then we look at the pelvic floor. So I'm looking like external first, checking out scar tissue, whether it's like the perineum or off to the side. I'm looking at like, what the skin integrity looks like, if they're breastfeeding, how is that playing a part in this? I have them do some contractions, just looking to see what the muscles are doing. I touch on the outside and then I do the internal portion, 1 finger, both sides. I have somebody do a contraction. I check for prolapse. I see how the muscle is squeezing, how it's letting go, what the scar tissue feels like. And a lot of times when you do those exams, I touch a structure like the scar tissue or a muscle or whatever. And then they're like, oh yeah, that's what I feel with sex.
Oh, interesting.
Like that feels like my skin is ripping. That's what it feels like when I have pubic bone pain. Or, oh yeah, that's my urgency. Like when you touch that muscle, I feel like I have to pee. And it's like, okay, then we kind of get an idea of what structures are involved and where we need to go and what the program is going to look like.